My name is Abraham Lawal. I am a health and social care lecturer, presently employed at Active Learning Reading College and Reading University Center. I offer you warm greetings and good wishes. This presentation aims to assist students in their preparations for the forthcoming external examinations in Unit 4, Enquiries into Current Research in Health and Social Care. The sample questions utilized are derived from the January 2024 previous questions, along with the examiner report and the marking scheme, which have been integrated and modified to create this video. Before exam preparation, you will have acquired the fundamental knowledge for Unit 4 Inquiries into Current Research in Health and Social Care. Alongside this video, you will receive the questions and marking scheme in written format, either as a hard copy or online, to guarantee your adequate preparation for the examinations. As conveyed by examiner's report, lead examiner feedback, examinations question paper, and the mark scheme results by the external awarding body Pearson, the set task information. You are required to use your understanding of research methodologies and associated issues related to a piece of current research on a health and social care issue, and your own skills to undertake secondary research around the issue. To prepare for the set task in Part B, you must do the following. 1. Analyze the article. 2. Undertake your own independent research using secondary sources. 3. Prepare the following for your final supervised assessment. A list of your secondary sources, notes on your secondary research. You can take in no more than 4 A4 pages of notes. During the supervised time for Part B, you will have access to this material. You will be required to address questions based on your chosen article and own secondary research. You will have 3 hours under supervised conditions to complete your final assessments. What is the assessment required of you? The assessment considers your ability to demonstrate knowledge and understanding of methods, skills, and ethical issues related to carrying out research. When undertaking your exams for this unit, you should demonstrate your ability to apply knowledge and understanding of research, focusing on analyzing information and data related to the current research presented in the assessment questions. You are required to interpret the potential impact and influence of research on practice and provision in the sectors. You will also evaluate current research to make informed judgments about the validity of research methods and future research areas. This is a life-threatening event, and although some people recover quickly, many others have multiple and long-lasting problems. These can include anxiety and depression, weakness and paralysis, and problems speaking and understanding. People who receive early specialist care, including rehabilitation, are more likely to regain their independence. However, patients in stroke units are likely to be inactive. They report being bored. Some say they are left alone for most of the day, without anything to do. Inactivity after a stroke has been found to add to mood disorders, and make any cognitive impairment, confusion, or problems with memory or concentration worse. Most approaches to increase activity in stroke care have been led by researchers, rather than stroke survivors or their carers. They have not been widely taken up beyond the research sites. This collaborative rehabilitation in acute stroke, CREATE study, brought together patients, their families, and staff to find solutions. This approach, called experience-based co-design, has led to improvements in many healthcare settings such as cancer care and dermatology, but it had not been previously tested in stroke units. In the CREATE study, researchers observed the activities of stroke patients in 4 stroke units for several months. They filmed interviews with stroke survivors and their families. They also observed 43 co-design meetings. Overall, staff felt the co-design process was more effective than previous initiatives and had increased the opportunities for activity. Stroke survivors and family members found participating in the study feasible, enjoyable, and worthwhile. They felt they were equal partners in determining priorities for improvements. The study identified factors which helped in co-design along with the challenges. The structured and time-limited involvement of researchers, who were external to the units, enabled key staff to participate while continuing with their usual work roles and responsibilities. But some staff relied on researchers to lead the process rather than taking on leadership themselves. This could mean that improvements stalled at the end of the project. Why is this important? The CREATE study found that a partnership between staff and patients can drive improvements in hospital stroke services. This work found that co-design was feasible, but also reported on the challenges involved. Their findings should help other research groups embarking on co-designed research. The researchers believe that short, edited films make patient and family experiences real, in ways that brief written questionnaires cannot. Staff were confronted with the fears, frustrations, and the positive and negative reality of stroke survivors' experiences when staying in a stroke unit. This may have acted as a catalyst for them to bring about change and increase opportunities for activities outside of planned therapy. Structured co-design, which involved researchers external to the units, enabled busy staff to take a full part in meetings where they reflected on proposed changes. This was important in introducing activities that could be sustained over time, but co-design groups were small, and it was challenging to involve wider groups of staff. New social spaces for activities were created in all the units which took part. The project increased engagement with local community groups. Charities and local colleges welcomed the opportunity to support their local hospital, and patients enjoyed engaging with them. Working with community groups appeared to improve staff motivation, helping them sustain commitment to making improvements to patient care. Beyond the study, staff members will need allocated time outside of their usual clinical roles to implement co-design. It is not clear how feasible this is for many stroke units. Managers' involvement and support will be key to allowing staff involvement and to enabling change to take place. What's next? Further research could explore whether this collaborative approach to driving improvements is effective in stroke units in other parts of the UK and abroad. It will be important to find out whether the improvements seen in the study were sustained over time, and whether they led to increased physical, social, and cognitive activity for patients. The researchers have presented the CREATE results at national and international conferences. They are developing a short video presentation to help respond to requests for advice from other stroke units. Hyperlinks are used in the article to access these links, addressing inactivity after stroke. The Collaborative Rehabilitation in Acute Stroke CREATE study. Fiona Jones, Carolina Gombert, Stephanie Honey, Jeffrey Cloud, Ruth Harris, Alistair McDonald, Christopher McKevitt, Glenn Robert, David Clark, 2021. Co-designing organizational improvements and interventions to increase inpatient activity in 4-stroke units in England. A mixed methods process evaluation using normalization process theory. Set task, Activity 1. Make sure you answer all the questions asked in Task 1A. Demonstrate your understanding about the suitability of the research methods used in the article. Provide evaluations of research methods and support them in the context of the article, as stipulated in the MARC grid for this assessment. Please note that if you describe primary and secondary research as methods without elaboration, or including the actual research methods used in the article in context, you will not be awarded marks beyond Band 1, as that kind of responses will not fit the descriptors of higher bands. Guide to answer Activity 2 questions to score higher mark. The assessment focus for this activity is understanding the importance of the issue being researched, why the research is being carried out, and how the article and your own secondary research reinforces the importance of the issue. You are expected to understand the importance of the issue in the article and include relevant examples of how the research has affected individuals and/or professionals and/or wider society. You should include secondary research in your response, demonstrating an understanding of the relationship between this and the article provided. The article for this series focused on the issue of stroke care in the UK. The activity requires you to consider why this issue is important and how it affects stroke survivors in the UK. For example, considering improving outcomes, reduction in activity, promoting independence, and so on. For the main part, responses to this activity highlighted the issue with relevant and interesting secondary research. Consider the importance of research for the individual with good understanding of the implications of having a stroke beyond the secondary research. You must choose good quality secondary sources for this activity, which allows more analysis beyond descriptions of what happens when having a stroke to be considered. To score highly in this activity, you must consider and include in your answer things such as the impact of sedentary behavior after a stroke, the cost to society of stroke rehabilitation, the increase of strokes in the UK, and so on. Activity 3. Question: how could research into improving the care of service users after a stroke affect the provision of health and social care services? In your answer, you should consider the effect on provision and/or practice, your recommendations for change in future provision and/or practice based on your secondary research. 20 marks. Guide to answer activity 3 questions to score higher mark. According to the examiner's report for this examination, where candidates had sourced good and reliable secondary research, they were able to provide full and detailed accounts of the importance of research into stroke care. However, while you focus on the implications of having a stroke, to score higher marks, you must be able to consider the impact of the research on individuals, professionals, and wider society, with sound understanding of wider society in general. The assessment focus for this activity is research implications for future provision and/or practice. You are expected, as a candidate during exams, to provide implications of the research for future provision and practice in the sector, with analysis of these implications. You should show understanding of the issue and implications in both the context of the article and wider research. You should also consider recommendations for change in provision and practice, with justification. This activity considers the implications of research on provision and practice in the health and social care sectors in relation to stroke care in the UK. According to the examiner's report, where candidates understood this, they provided good analysis of the issue, using relevant and well-thought-out secondary sources to support the issue presented. To score higher marks, your responses must consider implications and recommendations such as the repurposing of social spaces, person-centered planning, and the need for policy to support professionals in practice. Activity 4 scenario. Joshua is a stroke nurse practitioner who is in charge of supporting community projects and activities outside of planned therapy for stroke recovery. He aims to implement a range of activities including a choir, arts and craft activities, and physical activities. He will work with an occupational therapist, a speech and language specialist, and a family and care support worker. They will work together to investigate a range of community projects and activities to support recovery after a stroke in collaboration with service users, their families, and the local community, including schools and colleges. Joshua will use questionnaires with the families of service users who have suffered a stroke to assess service user needs and family support needs at the start of the research. They will interview the stroke patients before, during, and after the project to consider how well the activities have benefited recovery, alongside checklist observations of their recovery progress. The local community will also complete a questionnaire before and after the implementation of the activities to assess their level of engagement and future contributions. Question: what should Joshua consider when undertaking this research? You should include judgments on planning considerations, ethical issues, research methodologies proposed, and research skills needed. 15 marks. To achieve band 4 marks, you must cover each bullet point in the activity, offering clear and consistent evaluations of all points made. You must contextualize your response, evaluations, and be specific to the context. According to the examiner's report for this unit, for example, you will get higher scores if you are able to consider ethical considerations from the point of the participants being vulnerable after a stroke, needing advocates, and so on. You must not simply explain what consent is without the consideration of informed consent or consent being implied from the advocacy where needed. Finally, remember to answer all questions because failing to do so may result in a loss of marks, affecting your scores. Use professional language in your responses, and make sure you have read the questions accurately and understand what they are asking you to do. If you misinterpret a question, you are more likely to respond incorrectly. I hope this video helps you prepare for the upcoming external exams in Unit 4, Inquiries into Current Research in Health and Social Care. The sample questions used are based on previous questions from January 2024, as well as examiner feedback and mark scheme outcomes, which were combined and adjusted for the purpose of creating this video. I thank you. Good luck.